All right, let's move on to the final case, number 10, no moss. And this was submitted by Cassandra Koid Jia Shin, a Pediatric Emergency Medicine Fellow from Seattle Children's Hospital, and she was helped out by Stephanie Pryor and Jeffrey Otjen, who's a radiologist. It's a 2-year-old girl who presents with progressive bilateral leg pain and swelling that has worsened over the past 2 months. She responded somewhat to NSAIDs and x-rays at the symptom onset were normal. Initially, she was limping, but then she resorted to crawling, and now she cannot lie flat without pain. On exam, overall, she's well appearing with normal mental status, heart, lungs, and abdomen. She does have some notable gingivitis. She sits with her right leg flexed, abducted, and externally rotated, and she holds the left leg straight. She also has bilateral pitting edema. Here's some notable lab findings. The white count with a normal peripheral smear of 7.5. Hemoglobin of 7.1 and hematocrit of 24.6. Her MCV is 74.5 and her RDW is 17%. Her LDH is up at 959 and she has normal electrolytes, CRP, CK, albumin, and urinalysis. Imaging was obtained including an X-ray and an MRI, and here's a sample of both. Can you guess the correct answer? Is it A, scurvy, B, juvenile idiopathic arthritis, C, lead poisoning, D, chronic recurrent multifocal osteomyelitis, or E, chronic lymphocytic leukemia? For one last time, you get 30 seconds. Correct answer is A, scurvy. So they found out that this kid was a very picky eater who only ate animal crackers, Oreos, and ramen noodles with egg. She might as well be a college freshman. Additional labs showed a very low vitamin C and vitamin D25 hydroxy. She was admitted and received high-dose vitamin C and vitamin D repletion and iron. She was discharged home with multivitamins, including vitamin C, D, and iron, and nutrition and PMD follow-up. Her repeat vitamin C level had improved 1 month later. So scurvy. This is vitamin C or ascorbic acid is the oldest recognized nutritional deficiency. Signs and symptoms appear within a few months of a vitamin C deficient diet. So this is how Sir James Lind figured out that eating citrus while you're at sea didn't turn you into a guy having scurvy. Limey Brits. Reemergence in pediatric populations has been seen with severe dietary restrictions, food aversion, neurodevelopmental disorders, malabsorption syndromes, and psychiatric illnesses. It's often called the Great Masquerader. It can be misdiagnosed as osteomyelitis, septic arthritis, tumors, leukemia, bleeding disorders, rheumatologic conditions, or even child abuse. The most specific symptoms include follicular hyperkeratosis and perifollicular hemorrhage, with petechiae and coiled hairs, which I don't have. A limp could be the presenting symptom with musculoskeletal pain due to hemorrhage into the muscles or into the periosteum. So let's take a closer look at that knee x-ray. You have Trümmerfeld zones, which are lucent metaphyseal bands underlying the Frankel lines. And Frankel lines are dense zones of provisional calcification. You have a little metaphyseal spur named bipelkin, and you see some fat stranding and edema in the soft tissues. Now for the MRI. You've got subcutaneous edema, myositis, periostitis and subperiosteal hemorrhage, and then edema of the marrow. Here's a normal one for comparison. So treatment of scurvy is really prevention, so eating an adequate amount of daily vitamin C. In infants, that's 25 mg per day, children 30 to 40, and adults 40 to 75. Treatment is vitamin C supplementation and dietary modifications. The constitutional symptoms, that fatigue, lethargy, pain, and anorexia, generally improve within 24 hours of supplementation. Bruising, gingival bleeding, and perifollicular hemorrhages improve within 1 to 2 weeks, and complete recovery generally occurs after 3 months of supplementation.